Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. Now welcome to Ask Dr. Cummins. Please call 587-8176. Ask Dr. Cummins.
Yeah. Good evening, Dr. Cummins. How you doing this evening?
I'm doing good, Leon.
Oh,
how are you today?
Baby, it's cold outside.
It is.
I went to Memphis this afternoon. Well, this morning, actually, around. I left here at 9:30, and doggone, it started. And in 1994, the day in February, the 19th of 1994, was exactly like today. But we went ahead, me and my wife, I took her to the doctor, and I said, this looks eerily familiar. And sure enough, it snowed on us all the way. And Memphis actually had, between Memphis and Collierville, they actually had about an inch of snow. So that's
well, somebody needs to get that thing out to that groundhog.
Well, now he said he didn't see us yet.
He did not. So
hurry up. That's 6 weeks. It's too long.
He and Mother Nature need to work that out, because I'm ready for some spring.
We need that jet stream. We got to have the jet stream come in here and just get all the disease and the cold weather and just shoot it out of here.
I hear you.
How'd your weekend go?
We had a good weekend. We had some church activities and stuff, and but it was really good.
Did you got anything maybe on the agenda for the month of February or something like Diabetes Month or something?
Yeah, we've always got some month somewhere.
Yeah, it's always something going on.
Health related this month is American Heart Month.
Well, that's a good month.
So that's probably time to think about cholesterol checks and things like that, and make sure that ticker is working well. You only have one heart. And we missed, I didn't announce it last week, but last Friday was National Wear Red Day. And I believe that has to do with the lady's red dress you'll see on the pin. And I believe that's making people aware about women's heart disease, because a lot of times heart attacks that present typically and things like that are pretty much restricted to men. But women do have heart attacks too, and they need to monitor their cholesterol and their risk factors and things like that. So
let me ask you, you brought up an interesting point. Is a heart attack more prevalent in a male than a female?
Yeah, usually more men, and more men have them younger. So probably just by the, more people are alive at 40 than are alive at 60. More men probably number-wise tend to have heart attacks more often. Well,
I didn't know what the facts were on that. I had heard that, but men, I would think more physical over a lifetime. It'd be probably. Well, I don't know. Women. We're not ladies. I'm not saying you're not. I'm just saying men's. You kind of equate being more physical to a male than a female, but that doesn't necessarily mean that. But
I tell you what, nowadays, with all of our different jobs, we're so much more sedentary than we used to be. Men used to be a lot more active, and now and I think kind of the way our body makeup is, that we're having a lot of hard difficulty adjusting to this sedentary lifestyle, because we have a bigger muscle mass, or we start off that way. Our bones are actually more dense, they weigh more. So the way we're made is not really to be in a chair all day long. And unfortunately, a lot of times that's the way it happens.
Well, let's jump right into it. I got about 6 pages here. I'm just going to go at what causes a cyst and what can be done about it. a cyst.
Yeah,
That's just eating you right off the top.
There are different types of cysts, of course, and I guess everybody's going to learn me over time. I'm always going to say, well, there's different types of this, or there's a spectrum of that.
Well, it's a broad,
but it's true. But a general, what we call a sebaceous cyst, is a real common name. It's actually a misnomer. It's not a sebaceous cyst, but that's most of the time what we call them. And they usually start off under the skin with clogged pores. You get a clogged pore, and then it gets stasis, or stasis meaning that the fluid in that pore gets backed up, or it doesn't drain properly like it normally does, and then the body sets up like a wall, knowing that stuff is supposed to be going out. It protects itself from that stuff because it's hostile to the body, oftentimes having bacteria. So bacteria and all kind of other stuff grow inside that cyst, and it may sometimes spontaneously burst and drain by itself, or it may burst below the skin and get into healthy tissue and create a real big problem, or you go to the doctor and they lance it, and with proper surgical equipment and techniques, especially sterile or clean techniques, drain that dude out and heal it on up. But a lot of people, if you've ever seen a doctor do it, it almost gets a lining, and it looks like a muscadine lining, if you will. And if you don't remove that lining out of there, 9 times out of 10, you're wasting your time.
Well, is that kind of like the core on a pimple?
Yeah,
I mean, that's a simple, or a boil. That's kind of, you're talking about the core?
Or
you're talking about actually what houses.
The covering.
Okay, you're talking about the pus and the core and what holds that in there.
That's right.
You're talking about remove that.
Yeah.
Okay.
You got to get that little lining out. I learned that from my great uncle, who's a dermatologist, and some other dermatologists I've worked with in the past. But if you don't get it out, 9 times out of 10, that dude will just come on right back.
Yeah.
And you got to get that lining out. It's sometimes it's interesting how those things come out. And I won't get into too graphic for y'all. But,
no,
it's kind of fun sometimes.
All right, I hope that answered the question. All these questions have been asked by y'all, and we ask you to participate. Right there is the number, 587-8176. Please call that with your questions, no matter how small or how big, and Dr. Cummins will give it a shot. I'll ask it, and he'll answer it. And we'll do that every Thursday night between 6:30 and 7 o'clock for your viewing convenience. And we certainly appreciate y'all calling in with these questions. These are not my questions. These are questions that have been called in. Let's see. What is that? An older lady has a grapefruit-sized knot on her neck. What is that called, and what can be done about it, or what to do about it? Well, I guess you'd have to see it to be able to define it.
Is it on the back of her neck?
Yeah, she said on the back.
Well, it's basically, it's a better sign if it is on the back of your neck. And sometimes people that have endocrine or hormone type disorders can develop those things. And not to be, I don't know, I don't want to be demeaning by this, but oftentimes that's called a buffalo hump if it gets real big.
Oh, I've heard that term before.
And it can represent something called Cushing's disease. If your growth hormone and adrenal hormones are not acting right. There are some people, it's congenital. It means you can be born with it. Some people just have that hump. And a lot of people, if you've ever seen somebody with Down syndrome, trisomy 21 is another name for Down syndrome, and they can actually have that hump, and there's really nothing clinically wrong with them. It's just the way they're formed. But people with diabetes can develop those humps over time as well. But now, I was thinking when you first said it, I was like, man, I hope it's not on the side of the neck or somewhere in the front.
Or if it was.
Because then you think about thyroid problems or a big lymph node swelling up that's had a cancer that moved to it or something like that. And so those things on the front and the side are a little more concerning. On the back, it's not as concerning, but if that thing ever gets tender or swollen or your doctor's never looked at that or you've never pointed that out to them, you need to do so just to make sure, because you could have diabetes and not even know
it. Okay, so basically can form, or it could be hereditary.
Yep.
Well, I've seen them, and I've heard it called the buffalo back.
That's kind of a common.
I hope that answered your question. Next question, and this is kind of kind of broad too, but I'm going to ask it like it was presented to me. This man had cancer. He had surgery. They got it all. Now he has to wear a colostomy pack. Will this be permanent, or I'm sorry, I said a man. It's a woman. She's having to wear a colostomy bag. Will this be permanent, or will she ever be able to return to normal? And I guess you need to know what kind of cancer it is, what was removed.
Well, I tell you what, man, dealing with cancer is a tough deal, and my heart goes out to everybody who has to deal with that kind of stuff. That's a blessing that they believe that they got all that cancer out of there. Sounds like the patient had colon cancer of some form. A lot of times, they will do a colostomy.
Right.
And after a colectomy, that's when you cut out part of the colon. And sometimes, after a certain amount of time, they will go back and re-anastomose or put that remaining colon back together. So it may not be a permanent.
So there is hope.
Right, there is always hope. Now, it depends on how short that colon is now. That's the biggest thing, and how much they had to take out. But a lot of times they'll go for some period of time without.
Well, a colostomy bag is for waste, right. Body waste.
Right. Basically, you're number 2. You're B.
Number 2. Right. Okay, I was fixing to say number 1 or number 2. I guess it's basically number 2.
And you can have, if somebody has their bladder taken out, they may have an external bladder. Yes, that can be the case sometimes too.
Okay, and I guess they put it on the side wherever they go.
They may, and sometimes they'll even put an artificial bladder in the front. Really? And they've got all kinds of different things they can do now.
Well, it's improving every month. I guess
you just never know what's coming out next.
All right, here's a real hard one. What causes a cold sore?
Herpes virus.
Herpes virus.
Now, at first, that's the short answer, but it does not necessarily have to be the herpes virus. I think was famous in the 70s. Everybody was worried about having herpes. Okay, yeah. And but there are many types of herpes virus. So it does not necessarily have to be a sexually communicable type virus, but you can get it, and it's hard to kill it, and it
can't vote for me.
Yeah, it ends up going back. It comes out when your immune system is under stress, and it can also come out at other times, in just on its own. But that virus likes to live in our nerves. And not like our nerves that drive us crazy or get anxious about, but our real nerves, our nervous system, sort of get in what we call ganglion. It's little houses of nerve tissue. And then when you get a little stressed, that dude just eases out. Then your immune system fights it back, gets it back into where it likes to hide. But it's often very hard for your body to eradicate or kill that virus. So it's kind of like the gift that keeps on giving, unfortunately.
Yeah. And it comes back and back and back.
But, that being said, because we don't know what type it is and stuff, you do not want to have an open sore and let somebody else touch it, or you wouldn't be kissing on babies and stuff like that, and you don't want to spread it.
Right.
Wait till that dude is dried and scabbed.
It is contagious.
It can be.
Yeah. All right, I hope that answered your question. Here's another hard ball. Does wine really help anemia?
Well,
that's a wives' tale.
I don't know about it helping anemia.
It says, does wine, that's what she asked you, does wine, I've heard that wine helps.
I wish I could tell you that it does if you're a wine drinker. but actually, the big studies that have been done on wine involve red wine, and the biggest benefit to wine is that it helps the cardiovascular system, the heart system, the circulatory system, and will increase your good cholesterol and lower your bad cholesterol. That's 1 glass of wine a day. Okay? That's not getting your...
The toddy.
Right.
The old famous toddy.
Right. That's not taking the bottle and finishing her
Chug a
off
look.
at night. But that's where the evidence is on... And interestingly enough, there's no evidence that white wine helps. It's only been on red wine. And the French people who are real famous for drinking that wine... they've got some of the better risk factors and reduction of risk factors and proof that has really helped.
Drinking wine, spolioli, drinking wine.
Yep. Just not too much of the ripple.
All right, I hope that answers your question. Here's another one, and this one's kind of a strange one, but I'm going to ask it. It says a grandchild loves to eat ashes and dirt. Someone said that this was a medical problem. Is it?
It's a medical problem if it's not cultural. And let me explain to you about that. There are some ethnic groups and cultures that actually eat dirt, and it's part of like rituals and things within our society and our culture. And I can sit here and tell you that you will survive it because I was fed clay as a baby. I had a nanny growing up who took care of me. She was a black female, and she fed me clay. And
Clay?
Out the river. I had to come from a certain part at the riverbank,
Yeah.
and it had to be done at a certain time of year. And supposed to be good for your skin and hair according to their culture. Me and my brother.
Well, you still got hair.
Yeah, I still have it.
I didn't drink no
And,
clay. I didn't eat no clay when I was a kid.
But now, I turned out, I guess, basically okay. I'm not sure about my brother not playing. But anyway, that can be culturally, that can be okay. However, there is a disease process called pica, P-I-C-A, comes from a Greek word. But basically, if you have a mineral deficiency, you're missing some kind of rare mineral in your body, or
And
you
your
have a
body's
craving.
sitting there hollering and craving.
People will eat dirt, will eat ice, and things like that. And women are really known for that during pregnancies. They can develop that pica or that craving for something. But now those can be very serious if you don't have enough iron in your body, if you don't have enough iron, magnesium, calcium, things that your body and your blood need
Normal
to
every
help
day.
you heal and grow, and especially if you have a baby, to help that baby do well. Because ladies, the baby is going to get what it needs. That means it's going to pull everything out of your system to get what it needs, because that life is the way God designed that dude. That it's be all for that life of that baby. So if you're not getting what you need, you are going to suffer a great deal.
And that's why they give them this big old jug. Most of the time when somebody's pregnant, they get a big old jug of vitamins.
Prenatal vitamins.
Prenatal vitamins.
Because we know the baby's going to get pretty much 9 times out of 10 what it needs out of your body. But now if you start off behind the 8 ball and deficient in something, the baby may not get it either if you don't have it.
Well, if you don't have it, you can't get it.
That's it. And that's a lot of those B complex vitamins are very important for the baby's development of the neurological system. But anyway, that's pretty much is that pica in a nutshell. So it can be normal in some groups, but a lot of times it could represent a deficiency.
I hope that answered your question. We're going to break away for our sponsors. We'll be right back.
Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices, Food Giant. Now welcome to Ask Dr. Cummins. Please call 587-8176. Ask Dr. Cummins.
Welcome back to the Ask Dr. Cummins Show, 587-8176. Appreciate our sponsors. We'd like to ask you that when you go in at their place of business, please tell them that you saw their ad on TV 19, and TV 19 would certainly appreciate that. Back to our questions, Doc. I've got one here. Let's see, eczema. What is the difference between eczema and psoriasis? Any help for either? Either over the counter or prescription, either way. So eczema, am I pronouncing that right? E-X-C-E-M-I.
That might be the way they pronounced it. Typically, in medical speak, eczema.
Eczema, okay.
Eczema.
Okay, I'm sure I'm wrong.
And eczema, there is a difference. Or I guess you could say psoriasis is a type of eczema, but not all eczemas are psoriasis. Okay?
Okay.
Well, I'll make that a little more clear. Eczema basically is a rash on your skin of undetermined cause or etiology. It's a rash. It's an eczema. A lot of times they use that terminology, especially with children, his eczema. And that can connotate or mean a lot of different underlying causes of that eczema. Now, psoriasis, well, eczema can be dry skin, it just goes on and on. But psoriasis is a special type of rash, and that's usually due to a genetic disorder or inherited problem that you get where the surface skin cells in your body do not slough off the way they're supposed to. And it gets what we call in dermatology called hyperkeratotic or hyperkeratosis.
I've heard hyperkeratosis. That's on
Right.
television.
Oh, really? Okay.
Hyperkeratosis.
Because it doesn't fall off the way it's supposed to. Sometimes we get older, our skin doesn't come off the way it's supposed to anyway, and so that stuff builds up and it forms that silvery looking plaque, like it looks real silver. The skin, almost always that's psoriasis, but there are other things that can mimic or look like psoriasis. Okay, but both of those things can be treated over the counter usually. A lot of those both come down to moisture problems. By putting extra types of moisturizer, lotion, cream, salve on it, you can make it a lot better. Now, a lot of people make a common mistake. When you put on something like a lotion or want to hydrate your skin, you really have about a 3 to 5 minute window after you get out of the shower or after you wash your hands real well where you can really maximize the efficacy or how good that stuff's going to work, because your pores are moist and it'll suck it on in. Putting lotion on in between when your skin's dry, you reduce the efficacy or how good that stuff is going to work probably about 15 to 90% sometimes. There's a classic dermatology book that I have. It's got some nice pictures in it demonstrating. It took actually cow skin and had wet cow skin and dry cow skin. And the wet is so much stronger and it functions so much better versus the brittle and the dry. But the brittle and dry won't absorb anything. When you put that lotion, it just kind of stays on top. So that lotion, you put it when it's wet, it just sucks it on in. It really strengthens it.
Kind of like the paper towel. You can put a paper towel up to a water drop and it just sucks the water drop.
Right.
If the paper towels.
If it's the proper type. And so
Science project.
that being said, there is a difference between different types of creams, lotions, moisturizers. The more medical grade you get, the more into prescription type stuff you're going to get. But there's certainly some good over-the-counter ones. One I like to use is called CeraVe, and you can get it over the counter. We actually retail it in my clinic because I could not find a local place that had it.
Sarah, how you spell it?
CeraVe. And it's what most or many dermatologists like to use. And I have some other ones, one called Vanicream that is professional grade, but you don't need a prescription, that we also retail at the clinic. Really high quality stuff. But so you can go from that gambit all the way to prescription items. And the prescription things, they're stronger and work better for the right problem. But the reason why you can't get it just over the counter, if you misuse it or put it on the wrong problem, you may actually cover up something a doctor may need to see because it's not going to solve that particular problem. And if you cover it up, it could be a skin cancer or something like that. So that's why you don't find some of that stuff over the counter.
All right, I hope that answers your question. That's an interesting thought process. Here's a question, not necessarily a question, it's something that came up in the sports world. Lord, I wouldn't know,
Rhabdomyolysis.
That's just been in the news because it says it's a stress-induced syndrome that can damage the cells and cause kidney problems. It caused 13 Iowa State football players to be hospitalized from overextending themselves at the workouts. Did you hear about that?
I did not, but I am familiar with rhabdomyolysis.
That's what did it.
Yes.
That's something new. Can you got any kind of?
Yeah, it might be new to the public, but what it is, and things like that usually come out when something on TV puts it out there. But
Well, this was 13.
Yeah,
Very healthy college football players
Yep.
went to a workout, and that day the coach worked them so hard, put them in the hospital, messed their kidneys up.
All right. The best
It
thing
attacked
to do
it attacked their kidneys.
when you get these Greek and Latin words is to break down their meaning. And rhabdo, basically,
RHABDO.
is in myo means muscle. Okay, that's kind of your root of that whole word is muscle. Lysis is like a destruction. Okay, and basically the rhabdo is telling you that there is a destruction of muscle cells. And what happens is when you get dehydrated or you're not getting your proper nutrition and things like that, your cells start dying and breaking apart. And all the contents of them cells have to be filtered somewhere, typically the kidneys. And when that stuff clogs
that's
up,
where it went.
clogs up them filters of that kidney, because it's just filters is what the kidney is. And when that dude fills up, it can't work. It starts backing up, and you get into big problems like those young players did. And
Well, it put all, and to my knowledge, I think they stayed in the hospital for about almost a full week.
yeah, and you got to get lots of fluids to get all that back.
Well,
And,
could the coach? Is that something that was contagious in the dressing room, or
No,
could the coach, by
it's-
overworking them, cause that?
yeah, it's not a contagious disease.
Okay,
or
so
anything.
our kids at Ripley, or our kids at Faulkner, or our
yeah.
kids at Walnut could have a rough day at football, or a very hard day, and get something like that.
It could if things are not
Well, what would be
managed.
the sign of it?
But these players might have been infected with a virus that weakened their system already, and made them more likely for that to happen.
But unlikely, because it was 13 all different aspects of life.
They could all had virus
Okay.
in that locker room.
Yeah, because they eat together.
But the rhabdomyolysis itself is not usually caused by a virus. But in a immune depressed or they're immunocompromised, that type, it might have made it. That'd be really interesting. And I guarantee you, somebody who studies disease is called an epidemiologist.
Yeah.
They're going to be all over that.
Well, that was a question I had. Those 13 football players, and real quick, because we got about a minute left, somebody hit me with kidney stones. They're saying that's the male's curse, is a kidney stone as opposed to a female having a baby.
Yeah.
What's the truth on that?
That's what they say. They say that is
We
worse,
got about a minute. Kidney
worse than
stone.
having a baby. You want to make sure you do keep them kidneys hydrated. Lots of water. Cummins rule of thumb. Whatever drink du jour that you like to drink, alternate it with the equal amount of water between each one, and your kidney's going to stay in good shape.
Kidney stones is terribly painful, isn't it?
Ooh, I've seen some grown men cry, man, and I've heard women say way worse than childbirth.
Yeah. Well, women. I've also heard women say, that's him getting you back because we got to have the babies.
That's it. I've heard it.
Well,
There's a good treatment out there for it, by the way, whether you have an exacerbation or it gets worse, and there's ways to help prevent kidney stones from coming.
Anything you'd like to add, Doc?
Don't have anything tonight.
Well, we're going to have, let's see, it's going to be snow all week, is what they're saying, down in the teens. So I guess that old flu bug's still flying around.
Stay warm, and if you need us, we're out there for you. But hopefully we're going to be seeing some sunshiny days here soon.
We certainly enjoyed you being with us this afternoon. Be sure and stay with us every Thursday night at 6:30. The phone number to ask your question is 587-8176. We'll bid you good night, and we'll see you next week. Good night.
Good night.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor.